Hello, this is Dr. Harun Ilyas, and in this video I will be talking about this penetrating trauma of the pelvic bone caused by the surfing board fin. So if you are into mechanics and anatomy of sports injuries, consider subscribing to this channel. So before I discuss this penetrating trauma and the structures injured by such a trauma, let us have a look at the mechanism of the injury. And as far as the mechanism of the injury is concerned, I really do think that this is a kind of injury that has happened when a high-speed surfer has collided with another surfer, leading into a penetrating trauma of the sacrum, which is a triangular shaped bone present at the base of our back, and it is a bone that is quite thick, and it is usually formed by the fusion of few vertebrae. And to penetrate this bone, there must have to be a high speed penetration that this bone can be pierced. And I really do think this is a trauma that has not been caused by an assault, but this might be an accident during the surfing that might have caused this penetrating trauma. Now I would be moving on to the structure that might have been damaged due to this trauma, and the first thing that I would be discussing here is the nerves. And as the trauma is in the sacrum, so there are a lot of nerves that arise from this area, and these include sciatic nerve, pudendal nerve, gluteal nerve, and the nerves from the quadra equina. And the sciatic nerve is one of the main nerves that supply both of our legs, and injury to this nerve can paralyze the patient down from the waist. And apart from sciatic nerve, the other nerves also have motor and sensory function, and they are responsible for the defecation and urination process. And the damage to these nerves can result in bladder atony and few of the other quite serious complications. And now I would be talking about which vessels, which arteries and veins can be damaged here due to this trauma. And the most common artery that could be damaged here could be external and internal iliac arteries, and similarly there could be external and internal iliac veins that could be damaged due to this kind of penetrating trauma. And the patient has reached the hospital, and this is an image of CT scan that has been constructed three-dimensionally. And the patient reaching the hospital after such a horrific trauma is quite incredible, because the paramedic staff has a very difficult job to make sure the patient reaches the hospital safely. And even if one of the main vessels is not injured, that seems very unlikely in this area. There are a lot of other small vessels that could have been injured, and that might have been injured, and they must have resulted in a lot of blood loss of this patient. So now I would be moving on to the organs that could have been damaged by this kind of trauma. And the main organ that might have been damaged due to this penetrating trauma is the gut. And if the gut might have been injured due to this trauma, the surgeon would have to make a colostomy, or the surgeon would have to attach a bag in the abdomen so that the remaining portion of the gut could heal itself, and the patient defecate through the colostomy bag. And the next structure that could be damaged by this trauma is bladder. However, bladder, the urinary bladder lies more anteriorly, but there is quite a possibility that the surfboard fin might have moved anteriorly, and it could have damaged the urinary bladder. So if the bladder would have been penetrated by this surfing board fin, it has to be repaired immediately. And this is a classic example of multidisciplinary trauma approach, in which general surgeon, vascular surgeon, and orthopedic surgeon, including the trauma team, would be responsible in saving the life of this patient. So looking at this picture, there are very high chances of mortality in these kind of circumstances, in these kind of penetrating trauma, affecting such a crucial part of our body. And even if the patient survives, he has a very long road to returning back to his normal activities. So this is it from this video. If you are into mechanics and anatomy of sports injuries, consider subscribing to this channel.